On behalf of the National Cancer Policy Forum, I'd like to thank you all for attending, both here in person and we also have people on the webcast online. This is the first workshop in our series on improving cancer diagnosis and care, which will focus on patient access to expertise and technologies for oncology, imaging, and pathology. This is wrong. So the National Cancer Policy Forum provides a continual focus on cancer within the National Academies of Sciences, Engineering, and Medicine, and serves as a trusted venue in which experts can identify emerging high-priority policy issues in cancer research and care, and then to work collaboratively to address those issues. I'd like to take a minute to thank all of the sponsors of the National Cancer Policy Forum, which are listed here. Without their generous support, our work could not continue. And I'd also like to acknowledge the members of the Workshop Planning Committee and the Forum staff team, both of which are shown here. We deeply appreciate the many hours that the Planning Committee dedicated to developing the workshop program. Thank you very much. It has been a true pleasure to work with all of you. And special thanks go, of course, to our Planning Committee Chair, Hedvig Hricak, who brought this topic to the attention of the forum and led the development of the workshop concept, and will now provide an overview of the next day and a half. Hedvig.
Thank you, Sharyl, and good morning, everybody. It's really a tremendous pleasure and honor to be able to organize this forum, this workshop. We all believe that good treatment starts with good diagnosis, or good care starts with good diagnosis. So putting an emphasis on our gaps in challenges and the knowledge and dissemination is very important. I am very grateful to the committee members and hope you don't mind. I'll take a minute to read because each and every of us put a lot of hours and thoughts in preparing this. So to James Brink, to Chris Kagel, Michael Cohen, I can't read, Michelle Dill, Kojo Johnson, then Curtis Lankholz, Richard Shilsky, Bill Stead, Robert Wynn, and Wendy Woodward. Thank you very much all for what you have done. As you can see, it is a multidisciplinary committee. Once you work with the forum, which, by the way, is a part of the National Academy of Medicine and was founded in 2006. So it's a relatively young part of the IOM, you really realize how wonderful the staff is. And I think that for all of us on the committee, a big thank you, especially to Sharyl Nass, who was guiding us quietly in behind, making sure that we are always on track. And to this Erin Bellog, I know you all received a lot of emails from Erin, Natalie, Cindy, Kelly, and then again, and always Sharyl Nass. So to the staff, a sincere thank you. When we look at the IOM since late 90s, has a program that's very active on improving quality of care. And the two reports that really preceded this workshop and gave us idea was delivering high-quality cancer care and improving diagnosis in health care. And the last one was done in 2015. The report on the focusing on cancer care, examined the quality of cancer care, and concluded that cancer care delivery system is truly in crisis. They identify a number of issues which are so very current today, 5 years later. The 2015 report is called A Call to Action, and it pointed one thing that was essential, that is essential in our care, and that is collaboration, including patient and the family, and the importance to really understand each step along the continuum of care cancer care is not just one-time delivery. Overarching workshop goals and objectives include a highly qualified workforce for 21st century cancer diagnosis. Really requires a relook, requires all of us to look and see how to be accurate, cost-effective, and how to be timely. The report in 2015 identified error not only as a miss, but a delay in diagnosis as well. And that's where timely service is important. And then access to high-quality diagnosis for all population. We keep reading daily the difference in the quality between different parts of the country, or the difference based on our economic status or our ethnicity. We are going to have a workshop representation and discussion will highlight what we said, it's ongoing sea change in cancer diagnosis, how to emphasize the importance of interdisciplinary team, especially oncology is a team science. There are no more heroes. Each and every of us plays a very important role, and changing challenges of scaling oncology, imaging, and pathology to the community setting, as 65% of cancer care is done in the community. We organized this in 5 different, actually there are 7 sessions because 2A and B are split, and try to address everything from gap and challenges to education, to the role of technology. And just this is the time to mention that actually this workshop is a 2-part workshop. This one is to identify gaps, to identify challenges, and really to look at the human factor that we are missing, both for imaging and pathology, and also to look at the upcoming integrated diagnostics and how are we going to handle that. Integrated diagnostics is not aggregation of the information on one dashboard. It's really integration, so therefore data analytics are essential. And then the second part of the workshop in October is going to address all the technical tools that we have and how to incorporate AI, machine learning, and deep learning to really help in streamlining the process. So we said we have 5 sessions. With the last session involves stakeholders' perspective on the path forward, because as we said, our team science is not only physicians, nurses, and healthcare professionals. Our team science are patients, families, and all together, I think we can make a difference. And therefore, thank you very much for attending, and I'm looking forward to a spectacular day and a half learning and perhaps coming with some action items that we can implement. Thank you very much.